Good afternoon, everyone. My name is John Cheetah. I'm the Associate Executive Director at the Association of University Centers on Disabilities, and also the co-director in partnership with Denise Roselle at the AUCD of the Promise Technical Assistance Center, in which we partner with the University of Minnesota, and our colleagues from the U of M are here today as well. So I want to extend to all of you, federal and state partners, model demonstration projects, other invited guests with us here in the room at the National Press Club, as well as the hundreds who are joining us virtually via webcast, to today's celebration event, which is really the culmination of more than 5 years of work on behalf of youth with disabilities and their families. Our event today, promoting the readiness of minors on supplementary security income, or PROMISE, improving the trajectories for youth with disabilities and families living in poverty. It's my job to walk us through the agenda briefly, and then I will turn it over to our project officer, Corrine Wiedenthal, who will then introduce Johnny Collette, the Assistant Secretary at OSERS at the U.S. Department of Education, who will provide us with opening remarks. Following the Assistant Secretary, we will see a brief 10-minute video giving you a snapshot at a very personal level of the model demonstration projects that are happening across the United States in each of the locations. Following that, we will have a panel discussion with the California and Arkansas projects. They'll be discussing implementation of federal research demonstration projects, accomplishments and challenges in the context of disability and poverty. They will be followed by the Aspire and Maryland PROMISE projects, discussing systemic and local coordination and collaboration of services across agencies, wraparound services, resource teams, data sharing, and interagency partnerships. Our final panel will be representatives from the New York and Wisconsin projects, discussing federal, state, and local implications to ensure outreach, case management, education, employment, and financial capability training for youth receiving SSI and their families after PROMISE. We will wrap up with a brief discussant comments and a half-hour question and answer period for those of us who are joining us virtually. You will be unable to participate in the Q&A, but we have provided the contact information of each of our panel members and our discussant. You will find that contact information in the PowerPoint presentation that you all have access to. So it is now my honor to introduce our project officer and really the glue and nexus of coordination that has served to ensure that the PROMISE project has advanced on schedule, that each of the model demonstration projects have achieved the outcomes that they have on behalf of the youth and the families that they are supporting. She's operating within the Department of Education, but has also served to ensure that the federal partners are all on the same page with us as we have made this journey. So please join me, ladies and gentlemen, in welcoming Corrine Wiedenthal.
Thank you. Good afternoon and welcome. Thanks for joining our PROMISE presentation today, in which you will hear about programs' accomplishments, lessons learned, systems changes, and more. I'd first like to thank John Cheetah and all of the staff at AUCD in Minnesota for their ongoing efforts to support the projects and OSERS. I would like to acknowledge our many federal partners for their passion, insight, and for their ongoing support and partnership prior to fiscal year 2013, which was when these projects were awarded. There are too many to name, but I'd like to acknowledge some of you who have provided ongoing support, and I apologize in advance if I miss anyone. But I wanted to make sure that I do acknowledge your work with us, or your partnership with us. First from OSERS in the Department of Education, Johnny Collette, and before him, Michael Uden and Sue Swenson. Carol Doback, Acting Commissioner of RSA, Jerry Elliott, Suzanne Mitchell, Roseanne Ashby, and Mary Lovely from RSA. Marcia Silverberg from the Institute for Ed Sciences. From OSEP, the former Deputy Director of OSEP, Ruth Ryder. Larry Wexler, who attended every partner's call for 4 years and annual meetings and has been extremely supportive on the OSEP side. David Gardino, who is the Associate Division Director for the Secondary Transition Team, who stepped into Marlene's role after she retired. And of course, the other project officers. We are down from the original 12 project officers, David Emenizer and Celeste Avoke. Jennifer Sheehy from Department of Labor, who led the initial charge in OSERS before moving over to labor. And then Marlene Simon Burrows, who assumed the lead. Also from labor, many staff over there have been with us at the table from the beginning. Kirk Liu, Taryn Williams, Rhonda Basha, and many others. Carol Chikowski and Lori Collins, prior to their retirements from Budget Services, for their never-ending questions as comments as we drafted the notice, but now we thank you for that. We've seen the outcome. Jeff Hemmeter, Molly Costanzo, and Costa Jackson, who have led the evaluation, has worked closely with us from the onset. Also, Joy Cobb, who provided quite a bit of guidance due to lessons learned in the youth transition demos. Although not federal, I would like to acknowledge Mathematica Policy Research for the work they've done on the national evaluation and for being at the table with us since the beginning. I encourage you to visit their website to view the many reports they have provided, and they are extensive, I will warn you, but they're well worth the reading. From HHS, John Tambernino, who now has moved over to the Office of Management and Budget, but he provided support throughout. Also from OMB, Jamila Akbari, Melissa Turner, Jagir Patel, Jamie Wilson, and Bert Wyman. These partnerships have fostered relationships that will continue far beyond the project's ending this fall. With that, I would like to thank and introduce Johnny Collette, OSER's Assistant Secretary since January 2018. Prior to coming to OSERS, he served as the Program Director of Special Education Outcomes at the Council of Chief State School Officers, and also served at the Kentucky Department of Education as the State Special Education Director, as an Assistant Division Director. Johnny began his career as a high school special education teacher. Thank you for taking the time to come out and speak with us today.
Well, good morning, or good afternoon, isn't it? I think it is. Well, good afternoon. Growing up, I was sitting there thinking, growing up in the mountains of southeastern Kentucky and knowing a little bit about what it means to come from a low-income family, I was grateful, and I was thinking about how the thousands of students and families across the country must be grateful for your investment and the investment of so many. I'm certainly grateful for the investment of folks in my life, having come from some of those experiences, and really know that did help to change the trajectory, very likely, of my life. So just know, and I know you do, but there are thousands of real people, real students, real families who have benefited from your work and whose trajectories in life probably have significantly changed because of that. So I'm grateful for that. And it is a day of celebration, and we are grateful to be here. And, it's been a pleasure for us at the Department of Education to join our partners at HHS, at Labor, and at SSA in really supporting you in the work that you've led across states to provide innovative services and supports, again, to thousands of students and families in your states and across our country. We all remain eager to hear, as we have in the past, about the great success stories that you've experienced. Also, just as important are the challenges you've experienced in implementing your programs. And I am particularly interested, and you'll hear that a little bit more through the remainder of my remarks, but I'm particularly interested in the systemic change that is occurring across your states, and as you think about improving education and career outcomes for low-income children with disabilities who receive SSI. As Corrine mentioned, I was a high school special education teacher. I have been also an exceptional children consultant at a State Department of Education, a state special education director, and as she mentioned, a program director at a national organization that serves state education heads, and now in this role at the Department of Education as Assistant Secretary. And you know, I think about this all the time. Through all the roles that I have been in, I've learned that meaningful, efficient, and effective collaboration with all those who have a stake in the success of students with disabilities is critical to improving the outcomes that we envision, and certainly most importantly, they envision for themselves. And it reminds me of a story that I know some of you have heard me share before, but I hope it's appropriate for this setting as we think about the celebration of your progress and the great work you've done across systems in your state. One of my first IEP team meetings when I was a teacher was my student's last IEP team meeting. He was one of these young men who, if you caught him at just the right moment and he was being completely honest, he would say that school was one of the safest places that he knew in his life. And the reality is, while he wouldn't say this in front of his friends, he was a little worried about leaving, a little worried about what the next step was. And we all know that any transition at any point is difficult, and certainly that transition from school to adult life and whatever that means can be particularly challenging, especially if students lack many of the supports that we wish all kids had. So it was his last IEP team meeting, one of my first, and I remember at the end we handed him a very large binder, a big 3-ring binder that was filled with an overwhelming number of names of individuals and contact information of folks that could help him if he continued to need help after he left high school. It didn't dawn on me then, but it certainly has resonated with me, and in some way I will tell you all these years later still impacts, I hope, the way that I try to learn and lead today. When I look back at that event, I think while that was better than nothing, it was far from the best we could have done for that child, for that student, that young man. So I committed then and have tried to maintain that commitment across all the roles that I've had to involve all the relevant actors as early and as often as possible who have a stake in helping students be successful. And this included working across multiple state agencies in our state. And so I had the great opportunity to meet with state agency heads, other agencies who were serving students and families. And I think we met on about a monthly basis, if not more. And when we started meeting together and really identifying and thinking about how we could work together to solve problems across our state, a couple of significant things occurred to us. The first was this. I think this is going to resonate with all of you. The first thing that occurred to us is that we were serving the same kids and families in a lot of ways, right? So in those meetings, I called them a student, somebody else called them a client, somebody over here called them a patient, someone over here called them an incarcerated youth, someone over here called them a job seeker. But the reality is we were serving the same students and families. And we started to realize, I think rightly, that while there were issues from our agencies impacting kids and families across the state, it was not their problem to solve. It was our problem to solve because we've experienced what many of you do. You've got state agencies who are getting better at getting better in their own state agency, but many times students and families and providers and caregivers and others have a hard time navigating across systems in a state that don't do a great job always actually talking to each other. That's one of the success stories we've heard from you is you've started to crack that nut in your state in many ways, and it is a hard nut to crack, isn't it? But it dawned on us we were serving the same kids and families. And the second thing is that we could not be content just to get better in isolation. because we were committed to continuous improvement in our particular agencies. But we had to realize, I think, and be honest and confront the reality that if we were getting better in isolation, then at best that probably led to isolated impact. So we started to imagine what kind of collective impact we could have if we worked differently than we had in the past. So we took that on, and there were bumps in the road, of course, and lots of successes and lots of challenges. But as I was thinking about today, I was reminded of that work and how that experience and those experiences really give me a great appreciation for the work that you lead every day and the difficulties you face in improving across systems to better serve students and families. So what I've learned and what you know is we've got to take this kind of stuff on, right? And it's not for the faint of heart. And I don't think there's anybody in here who is faint of heart. I mean, your efforts and your story speaks for itself. But we've got to take some things on, and these are tough things to take on, but we need to. And let me mention a few. We've got to address systems that do not facilitate the improvement that we know is necessary for kids and families. We got to be honest about structures that may be limiting opportunities for kids and families in our state. We've got to be honest about practices that, when we're being super honest now, this takes some real honesty. We've got to be honest about sometimes practices that put the needs of the system over the needs of the child and over the needs of the family. Now, nobody wakes up every morning, nobody wakes up in the morning and says, I'm really going to do the best I can today to not think at all about the needs of kids and families in my state. Nobody does that. But when you get into the weeds of the work, this work is complex. The volume of this work is incredible. The pace of this work is breathtaking. Nobody wakes up and says, I'm going to do the best I can to mess up some kid's life. But when we get into the weeds of the work, sometimes we can act as though, practically it seems, that we are more concerned about preserving our system than we are preparing the students. So we've got to take that on, and we've got to take on policies that simply, no matter how well-intentioned, really don't have the impact of improving outcomes, and laws and regulations that constrain innovation. And one of the most difficult ones is taking on mindsets that appear intent on preserving the status quo. One of the things I think you've learned, and we've learned from you, and certainly many of us know, is that the status quo and a one-size-fits-all approach don't work. And our students and families deserve better than that from us. So the importance of meaningful and effective and efficient collaboration, I don't think can be overstated across systems. And the willingness of systems, again, that we've learned so much from you, the willingness of systems to be honest about, and the courage of systems to address anything that stands in the way of improving outcomes for individuals with disabilities is critical for any real and sustainable change to occur. It's simply unacceptable. I think you would agree with me. It's simply unacceptable for any student that we serve to fail to achieve the outcomes they could have achieved just because the adults around them cannot figure out how to work differently and how to work more collaboratively in service to them. That's the kind of commitment that we know this takes, and it's something that we must take on at every level. And you know this. You have experienced this firsthand, and we're grateful for what we have learned over these years, and will continue to learn from you about how states truly commit to change and truly position themselves to sustain those improvements over time. This is a celebration, I heard, right? Why aren't y'all smiling? It is a celebration. But let me challenge you. We need to celebrate, and we don't celebrate enough. But what I know is when you look at celebration, it's not a resting on your laurels, right? What a disservice you would do to yourself and to your work, much less the kids and families in your state, if the celebration was about resting on your laurels. Well, that's not what you want. That's not who you are. It's not the kind of leader you are. But any true celebration, in my view, recognizes the work yet to be done. It doesn't just celebrate the work that has been done. Any true celebration recognizes the work that is yet to be done. So we must remain committed to what we've been committed to. And I'm going to challenge you, as we challenge ourselves in OSERS and at the department every day, we must continue to demonstrate that we are more concerned about the preparation of the student than we are the preservation of our system. So the purpose of preserving the system is to prepare the students we serve. If it's not doing that, then the system, or at least something in the system, is broken and needs attention. So our focus should not be on preserving the system for the sake of the system, but on improving the system for the sake of those we serve. And at the Department of Education, we believe that those who are closest to the student, closest to the family, know their needs better than we do. And that means that no one is in a better position to imagine, to implement, and to sustain the changes needed to truly raise expectations and improve outcomes than you are and those you serve. So I and we at the department applaud your ongoing efforts. We applaud your ongoing achievements to improve systems so they can best serve low-income children with disabilities receiving SSI. And it remains our pleasure to serve you and to continue to learn from you. So thank you so much for being here today.
Thank you, Assistant Secretary Collette. You were 100% correct when you said they are not faint at heart. You have never met a group of more dedicated professionals than these directors. They have led extensive teams of dedicated professionals to work with our youth with disabilities on SSI and their families. These teams, partnerships, stakeholders, staff include Parent Resource Center staff, case managers, regional directors, staff from several state and local level agencies and organizations, all to support youth and their families. Systems change is happening as a result of their efforts to collaborate and coordinate across multiple agencies and organizations, and we really appreciate your ongoing support for families and youth, and we look forward to hearing about your future accomplishments and outcomes. I could go on and on. You're going to hear from them directly, and you'll see what I mean. Next, I would like to thank Peter Quinn from Cornell. He's part of the New York State Promise team for culling through multiple Promise podcasts and YouTubes to provide a snapshot of the voices and faces of Promise. I encourage you to visit the project's websites for further viewing. So with that, we will watch a 10-minute podcast that represents all 6 projects. Thank you.
For youth with disabilities who receive Supplemental Security Income, or SSI, maneuvering the path to post-school success can present obstacles and challenges. These young people experience increased dropout rates, decreased educational and employment attainment, poorer economic outlook, higher incarceration rates, and increased likelihood of a lifetime on benefits when compared to their peers with and without disabilities. To address these disparities, the U.S. Department of Education's Office of Special Education and Rehabilitation Services, in collaboration with the U.S. Department of Health and Human Services, the U.S. Department of Labor, and the U.S. Social Security Administration, funded 6 model demonstration projects. The purpose of promoting the readiness of minors in SSI, or Promise, was to test and identify evidence-based practices that improve the education, employment, and economic outcomes of youth with disabilities receiving SSI and their families. Each project was required to provide a set of core services that included case management, parent training, benefits and work incentives planning and assistance, financial literacy training, post-secondary education services, at least 1 paid employment experience earning competitive wages, and additional employment-related supports and services. These are just a few of the many success stories from these 6 demonstration projects and the improved outlook of the youth served. Meet Dennis and Tony from Wisconsin. Being enrolled in Promise has literally helped to transform their lives. For years, the family barely got by financially. Thanks to the work of Wisconsin Promise, Tony and his stepsister, who are in high school, are employed. And Promise assisted their father, Dennis, to go back to school and to become an auto mechanic.
Starting my own company, set a foundation to start the growth of a legacy for our family.
He now has his own towing business, which is turning into a family affair.
I know Tony is really big into wanting to help with the company and want to see it grow.
It's my most favorite is just going with him and going on tours, watching the lights and hooking up the cars.
With the help of Promise, Tony was able to go through a driver's training program and helps his dad with his new business. In the future, he plans to go to college. In New York State, Promise has helped to land high school student Jennifer on a successful career track to become a restaurateur.
My grandma had a restaurant down in Pennsylvania, and just my entire life she's been my inspiration, so it inspired me, to want to do it.
Jennifer has been working in the restaurant business for the past several years and is now in a culinary institute where she is learning professional cooking techniques. Jennifer has a lot of ambition, and with the help of Promise, she has learned interviewing techniques to aid her as she secured successful work experiences.
My future is going to be a big one. It's going to be big, it's going to be great. I'm going to really make something of myself.
3,000 miles west in California, Promise worked to help Reynaldo and his son dig their way out of a desperate situation.
The time my wife passed away, we do the SSI, and then Carl Promise provide me to do the mock interview, find a job, find a shelter, and helping some clothing to my kids.
California Promise assisted Reynaldo with developing skills, including educationally and exploring career interests. California Promise also helped introduce his son to the world of work. Back east, Maryland Promise has had a profound impact on Brian's life. Promise connected Brian with a computer shop. He's extremely savvy when it comes to technology.
I fix computers. I diagnose hard drives to see if they're bad or not.
The shop's owner, Sam, takes us through how the interview went.
I asked Brian, I said, okay, Brian, you work on computers? I have a computer right here on the counter that just came in that has a black screen that's not booting up. And Brian said, I know exactly what that is. I would update the BIOS, which is a technical term. A lot of people don't know what that is, but it shocked me. I was really surprised that he said that. And that isn't even something that I would have thought of at first. He kind of thinks outside the box, and he brings that to the shop, really.
According to Brian's mom, he has come a long way with being more independent and social since starting Promise, which will be needed in the workforce. Promise has also assisted Brian's family with financial education, benefits counseling, and negotiating the SSI redetermination process. Through the program, Brian's mom has also secured a part-time job, which is helping the family monetarily. In Arkansas, Promise's work is helping Lace to gain social skills, develop relationships, and earn a paycheck. She has been a hostess at a restaurant where she did extremely well, even though it was outside of her comfort zone.
My job helped me come out of my shell and start talking to people instead of just standing there staring at them like I don't want to talk to you. I actually said hi to them instead of just standing there.
It was really, really neat to see her bloom as a person and as an employee.
Lace would like to go to college to teach music to individuals who are blind. She has that desire because she herself was diagnosed with an eye disease. Aspire, which is the Promise region that covers numerous states including Arizona, Colorado, Montana, North and South Dakota, and Utah, has helped Louise and her grandson Christian. Promise has connected the family with needed services and supports, including financial education, transitioning to adult life, and self-determination training.
The moment Misty came into our lives, I came out of my head. I didn't have to do it anymore. I could then just embrace my grandson because she gave me the tools that were necessary to know what to do in the steps and the stages and the ways of moving him through this system that was such an absolute nightmare for me.
Promise has also helped the family to communicate, often a challenge with teenagers. They are now working to find common ground so they can move forward together. Back in New York State, Evelise is building an impressive resume thanks to Promise. She has worked numerous jobs, including one that used her technical skills that she has developed with Adobe Editing Suite. In each job, she is building communication skills and developing relationships and work ethic.
They seen my resume and they automatically seen that I also had experience with Adobe Suite, and they said, oh, that's really good. They need people like that.
Evelise is now in college and will soon be graduating. She will be seeking a job in the film production industry where she can utilize her technical skills. For Hours South, Maryland Promise has been able to train Antonio's family in financial literacy.
Me and my mom and my sister, we went to a budgeting class and taught us how to budget so it could be easier on not just me, but my mom with the bills and stuff.
I think the leading factor in the success of this program are the relationships that we build with the kids. We actually get to their level, we learn about them, we're interested in them, and when they see us investing in them, that gives them the confidence to go out and do great things.
You can find more impact stories by checking out the various Promise regions' websites.
Pretty terrific stories and examples of the youth and the families that have lives have been changed by Promise. But what is Promise? I'm David Emenheiser. I'm one of the project officers for the Promise project, and I'm here to give you a brief overview of that program. There we go. Promise is a one-time grant opportunity that resulted from over 200 million unmatched VR funds when the economy tanked back in the late 2000s. The administration and Congress established Promise to investigate how to improve education and employment of the youth with disabilities living in poverty and their families. They required partnerships among the Departments of Labor, Health and Human Services, and Education, and the Social Security Administration, which is funding the national evaluation of the projects. Education, the Department of Education and OSEP awarded the grants to the projects and to the TA Center. This is the Promise conceptual framework. The blue oval in the middle, I'm not expecting that you're able to read that or to see it here, but the blue oval in the middle identifies what the Promise stated purpose is. The boxes above and below that oval identify some of the barriers, both personal and environmental, that we've known through research impact these families. The two boxes on the right highlight our desired outcomes of improved education and employment for these youth and their families. And the green box on the right lists the activities that were required of the projects in order to address those barriers to reach those outcomes. And we'll talk a little bit more about what those activities are in just a minute. One of the reasons why this is a one-time grant opportunity is because this is a research study. So 13,500 participants have been enrolled in this study. Don't worry, nobody was denied any services. Those who are in the control group are getting services as usual. It's the Promise youth and families that are getting those enhanced activities. And as you can see that the youth were on the younger side of transition age, 14 to 16 years old at the time of enrollment. So we funded 6 awards in fiscal year 2013, and these are 5-year awards. So with no cost extension, you can do the math, and they're all coming to, they're going to be closing up in just the upcoming months. The TA Center, among many other things that they do, supports a website hub in which the project information and resources are available. And that website is promisetacenter.org. So here is a map of the 11 states that are participating in the 6 projects. New York, Maryland, Wisconsin, Arkansas, and California are single state projects. Utah, South Dakota, North Dakota, Montana, Colorado, and Arizona applied together as a consortium called Aspire. As you can see from the map, in my opinion at least, the 11 participating states provide a representative cross-sample of the United States. The youth and families living in some of America's largest cities have been served by Promise. For example, New York City, Los Angeles, and Phoenix. Also, the projects recruited from the projects that recruited across the state are also serving families that live in rural areas, like the Maryland Eastern Shore, for example, or parts of Wisconsin, the northern areas of Wisconsin. Some youth and their families live in very isolated frontier areas of the Dakotas and Montana, and even some parts of Colorado are frontier. Aspire specifically targeted enrollment of youth living in Native American communities and on tribal lands. So what did they do? The required activities of the project. Partnerships were required that mirrored the federal partnership requirement. However, the constellations of these partnering agencies varied greatly across the 11 states. These partnerships needed to provide intensive case management, benefits and financial training, employment, education, along with parent trainings. The same services were offered to youth regardless of where they lived in the states. And we're going to hear from the projects in a few minutes of some of the workarounds and ways that they addressed those challenges in order to meet that requirement. The inclusion of families as recipients of the services made a great impact in the difference of how these projects could address both those personal and environmental barriers. So some of the key facts that I want you to keep in mind as we listen to the following presentations. Nearly 1/3 of the youth and their families live in rural communities. One project only identified, New York only identified certain urban centers as their recruitment area, so they didn't have any rural youth. All these youth receive SSI, Supplemental Security Income, which means that the families are living in poverty. And although the youth have disabilities, they don't necessarily have an education plan, whether that's an IEP or a 504 plan. Here is one of the slides that has our contact information of the 3 project officers. And during the next part of the presentation today, we're going to hear from those 6 projects. And we're going to hear first from Arkansas and California.
Good afternoon. My name is Brent Williams, and I am a professor at the University of Arkansas, and I am the principal investigator for Arkansas Promise. What I'm going to start off with this afternoon is to give you a little bit idea of the landscape at the time that Promise was implemented. While there had been some initial research on school-to-work transition for youth in transition that looked at particular approaches, particular interventions, there had not been a preponderance of research that looked at large demonstration models that could really do an integrated and wholesale approach. There had been the youth transition demonstrations, which had showed that Social Security benefits counseling, paid work experiences, and a more collaborative approach to service made a difference. But still, a cohesive model needed to be developed, and that was what Promise projects were tasked with, developing this cohesive, integrated model. At the time, this was pre-WIOA, remember, communication between state and federal partners, between state agencies, between community resource providers wasn't articulated. It hadn't meshed. That was the purpose of the Promise models, to develop this integrative, holistic approach that could provide these services and hopefully really facilitate outcomes in education and employment. And this next point may look like an ancillary point. As you would imagine, gearing up to provide services to 1,000 or more folks is a process. And soon after Promise projects were funded, we realized that the government was shut down, which you can't do anything during the shutdown except reflect on how much time do I have to do recruitment, how much time do I have to do the intervention. But what it did, I think, and I can say this personally, but I think I can say this for everybody involved, it made us incredibly mindful that we had big rocks to move in a short time, and that sense of urgency really did exist throughout the rest of the project. Now, to give you a little insight into the population we were serving, you've heard it so far, but maybe the best conceptualization I can give you for this is the nexus of disability and poverty and marginalization, often in the form of minority status. And if you think about this isn't a summative process. If you think of a three-circle Venn diagram and the youth and families we served as being in the middle, it wasn't just this confluence. Membership in all three of those categories greatly exacerbate and greatly magnify difficulty in access to resources and in the just kind of lack of indigenous opportunities that are available to folks. And so in thinking about this convergence, we were dealing with some of the most marginalized folks within our country. This marginalization, this lack of resources, this lack of opportunities is what facilitates generational poverty. It's what facilitates ongoing reliance upon benefits. It's what generates isolation. It's what generates lack of community involvement. That was the population we were dealing with. But another key element to that population was distrust. Most of you in the room know that applying for and receiving services is an arduous task. It's not fun. You are told no, you were put away, you're not sure how the eligibility works. It's tantamount to hazing in many ways. Not because the system is bad or because the system seeks to hurt people. It's a difficult process. One of the things, and while the assistance is incredibly beneficial to families, one of the fundamental things that they do receive is consistency and ability to predict the future. Though their life is not necessarily well-resourced, the consistency and expectancy is there. We knew as Promise that we were going to be asking people to maybe challenge that, to maybe give that up, to maybe think about a trajectory that was different. For folks that are not particularly trusting, that are wary, that's a very big ask to give up the one thing that really seems to be vital to their existence, which is expectancy and consistency. And we knew we couldn't do that with a 5-minute phone call. We knew we couldn't do it with a 15-minute visit. Promise, and this is pervasive throughout all the projects, was a relationship-centered approach. In Promise, we call it our case manager connectors, but throughout all 6 projects, it wasn't about a field office visit. It wasn't about a phone call. Promise worked because we developed relationships. So if you're going to gain someone's trust and you're going to the trouble to develop a relationship, the next thing you've got to do is get buy-in. It can't be because I say so. It can't be because we have a metric we have to measure. It has to be a change in the expectation of the family and youth. They have to believe that a new trajectory is possible. Now you see on the slide though, this says a little bit about the population. Well, in Promise there was actually another population we were working with. And that was our partnering agencies. That was the community providers. That was the state agencies. Because we knew that their expectations had to be changed as well. If we got the families and the youth to buy into maybe a different path forward was possible, we knew we couldn't make progress unless the population of our partners believed that as well. Now, when we talk a bit about project design, you heard from David that Promise existed across the United States and in very, very rural areas, very urban areas, and you've seen, you can Google up and see the different subcultures of the United States. I think we've already said this, but it bears reiterating because it is very important. Promise was never conceptualized as a cookie cutter approach. We knew that while we were providing consistent and very specific tasks, and all of us provided these services, we all provided these services, we knew we had to be responsive in the rural areas, in the urban areas, across the different cultural parts of the United States. Promise knew that it had to be a nuanced approach, because hopefully, if we've demonstrated this model works, the way it's going to work is there'll be federal legislation. The federal legislation will enact ways to hopefully pay for this and move forward. This will be enacted at the state level, but the boots in the grounds will be in the cities and the counties. And we know that the one-size-fits-all cookie cutter doesn't work, and that was never the way Promise was designed. And to that point, there's 3 points in particular I want to talk about that really were an integral part of the design. One, that it was family and youth driven. If you ask somebody to trust you, if you build a relationship with someone and you say, please change your expectations, the very next thing that you cannot do is say, and let me tell you what your goals and aspirations should be. Let me tell you what that path is. If you're going to ask someone to trust you, if you're going to build a relationship, if you're going to change their expectations, you need to facilitate their ability to make their goals and dreams real. That was the function from Promise all along. Second point is the holistic approach. I don't have a Maslowian pyramid up there, but one of the things that Promise knew and understood all along, if you're hungry, your rent's not paid, if your physical health and your safety haven't been taken care of, resources haven't been dedicated, then some self-actualization toward a career simply won't happen. It's hard to overstate how important that was to the Promise approach. This holistic understanding that people don't exist in a vacuum, that a job opening is not going to happen by itself, that an education appointment to see where you might want to go get training doesn't happen if you don't have transportation, doesn't happen if your electricity is turned off. That was one of the key fundamental elements to Promise. And the final element, I guess, when I say interest-based and customized, that's really the follow-through, right? If you ask someone to trust you, you develop a relationship, you then say, change those expectations as is possible. I ask you what you want to do, what your hopes and aspirations are, and at the very end I say, well, here's the same 3 job openings I give everybody. Here's the same technical training I give everybody. This is what we've always done. There'd be no point in that. That was the follow-through for Promise. From the start to the finish, it was about a holistic approach that was driven by the youth and the families, and in the end provided them with an individualized, customized option that we hope, as you heard from the opening remarks, can really make a long-term impact on employment and education outcomes. Thank you.
Well, good morning out in the West Coast. Good afternoon here on the East Coast, and I have no idea where it's way out there on the islands. So first of all, I want to thank my fellow panel members. I'm Joe Xavier. I'm the director of the California Department of Rehabilitation, and I'm a partner in the California Promise project. I certainly want to give a shout out to my VR colleagues across the country here in the room, as well as our special education folks. Because to me, when we think of Promise, you're going to have a lot of information, but I would ask you to remember 3 very simple things that make Promise what Promise is, and more importantly, what it needs to be. And it's not complicated, it's really very simple. It's student and family, relationship and partnership, policy and systems alignment. You get those three things and you have the promise of tomorrow. So I want to talk a little bit about accomplishments and a little bit about some of the challenges that we faced in California. And this will very much come across as from the lens of the consumer, the student with the disability and the family, as well as the administrative role. So first of all, when you think of the student and family, what Promise accomplished was to advance the pathway, the opportunity for youth with disabilities and their families to attain a family-sustaining wage. The success of providing work experience to people who otherwise may not even have thought of work is invaluable to opening up the world of possibility and the world of opportunity. Kids that are staying in school have an opportunity to advance their education, to be able to prepare to meet the talent needs of the businesses. And family engagement is key. But remember, just like we talk about individualized for the student, it's individualized for the family. If you've met one family of a student with a disability, you've met one family of a student with a disability. Because if we don't look at it that way, we start with that cookie cutter. Partnerships and relationships. Our ability in California to leverage a 30-year partnership with special education is what made Promise come alive, is what allowed us to do the work that we're doing. Special education's ability to leverage the trusted relationship that they had with the youth and the family was integral to the work that we've done. And collectively, getting our staffs together to train together, work together, and think together about how to serve the individual and the family was key. What are the challenges that we faced? First of all, when you think of the students and family, think about work experience being so beneficial. But work experience must be for the most significantly disabled. Exception, none, right? And it's an essential belief that we collectively must have that work, the talent, and the potential of every individual can materialize and be realized in their work. And it must be, again, we leave no one behind in the pursuit of that family-sustaining wage. Remember that youth do not start with an expectation of work by and large. So a lot of times, we're the first ones that bring that to the table. The other reality that we need to deal with is that the family engagement does not live in any one system. It would be great if we had a way of linking a family to somebody that can help them navigate the morass of systems and processes that they need to receive the services they need. But today we don't have that, so we need to continue to look for ways to do that, right? And we need to have that collective belief, that collective partnership in achieving that. One of the things that I think is important for us to remember is that today it's pursuit of competitive integrated employment. But a lot of the kids that we're talking about are not growing up playing together and learning together. So when they show up in the workplace, it's looking like odd, different. We need to get to the point where kids are learning together, playing together so that they can work together and lead together. And we're not leaving anybody behind with that. I want to talk about, very briefly, about systems alignment. Scaling of what we've done in Promise, in my opinion, requires major systems alignment across all of California, and I would submit across every state and every territory. And essentially to that is that whole person care. As Brent has mentioned, as you will hear through others, there's that need for that. So we need to continue to find ways to do that. And then the other thing that we need to think about is business. We have to find ways to better engage business and bring them on board, because you cannot have a family-sustaining wage without a job, and business is the one that provides that job. So let me introduce now Dr. Fred McFarland.
Good afternoon. I'm Fred McFarland from San Diego State University. We've been involved in the research, training, and technical assistance part. And I'm going to touch on a couple of areas. One will be some performance outcomes. One of the expectations we had when we started was high school graduation for the youth. And as we have followed that information so far, We're at about a 78% high school diploma or GED with those students. There's some additional ones that have also received a certificate as a certificate of completion. But the number that's probably most important from our standpoint is there's only been 24 students have dropped out of high school, out of the research group. And that was attributed to much of what my two colleagues have mentioned, that personal relationship and being able to engage the family and the youth as a part of that. A second aspect we looked at was the issue of work experiences. And when we initially designed the model, we said that each student would have an unpaid and paid work experience, and that would be at 100%. We didn't quite make it with the unpaid, which was interesting because a number of students got paid work experience before the unpaid. And the question came up is, well, do we have to make them go back and work for nothing? We didn't think about that as a part of that. Obviously, no. But as we've looked at the combination of either paid or unpaid or a combination of both, we're at about 97% of the participants have had that experience. And as Joe had indicated, nobody was left behind as a part of that. One additional part that we looked at was the engagement of families that were a part of the experience. And engagement as consumers with the Department of Rehabilitation and other community agencies. We ended up working with about 1,400 community agencies in California as they supported both the youth and the families. Program accomplishments, and I'm going to iterate what my colleagues have said. It was driven by the student and supported by their families and services provided to both. California is incredibly diverse across every dimension one would look at. We served about 135 separate school districts, all the way from LA Unified to places out in the desert that I had never been to. And we drove it by what were the needs of the student and the family, not by the needs of the systems or the schools. A key element was starting in the schools and working with the school programs. As Joe had indicated, California's had a long history of doing that. And they worked in partnership with the Department of Rehabilitation. About 94% of the students are now consumers within the Department of Rehabilitation. We followed up on those that were in the usual services group, and that represents about 16%. So just that continuation of services beyond high school provides that sustainability that we found is critical. The final piece that we looked at was the issue related to families. I don't think we can stress enough how critical the family engagement piece was, and that the staff, both in the schools and with the Department of Rehabilitation, didn't meet them in offices and didn't meet them in classrooms. They met them in their living rooms. They met them in Starbucks. I suspect we've spent a lot of money in Starbucks over this. But they met them in a variety of places. They would meet them early in the morning and take them to school. They would participate in funerals and weddings and birthdays that the family had. They became a part of that extended family. And that relationship is probably the key element from our experiences through this entire process. And it's got to be one that cannot be lost. It really does start with the youth and the family. Thank you.
Hi, I'm Carol Rudell, and I'm the project director for Aspire, that 6-state project involving Montana, North Dakota, South Dakota, Colorado, Utah, and Arizona. And I work in the Utah State Office of Rehabilitation in the Utah Department of Workforce Services. So as we talked about, and you've heard from David in terms of what we were required to do at the federal level, we also had some interesting requirements in terms of who our partners are. It's clear that no single entity can do all of this. So immediately within our proposals, we were required to partner with 7 different federal flow-down agencies in our states. So that included vocational rehabilitation, special education, Medicaid, TANF, workforce, developmental disabilities, mental health agencies, and we also had to have the sign-off from each of our governors. So in Aspire, that meant 6 states times 7 agencies is 42 agencies, as well as 6 governors. So it gets a little complicated for us. But one of the things I think we probably learned the most is that those 7 are not enough. It goes beyond those 7 entities. And I think in particular, we discovered that we needed to coordinate well with our juvenile justice system, as well as our housing system, transportation systems. In Aspire, we certainly learned how to work with our sovereign nations, our American Indian nations. You know, as sovereign nations, that means we have to go to their tribal councils or their institutional review boards just in order to speak to individuals who live on those lands. So it was much more than the 7 original agencies that we're required to work with. Certainly, there's a perception within, if you think of the poverty agencies versus the disability agencies, and oftentimes there was a disconnect between the two, and understanding that mutual benefit when coming together for an individual youth or their families. The message, the philosophy, the idea of you can do this, you can go to work, and being able to move that forward within a family by partnering together. Certainly, we had to move beyond this idea of state or agency. We created local resource teams across all of our projects that enabled us to really look at the specific services designed for that youth and that family. Youth and family needs are in a constant state of change. When you live in poverty and you're faced with extra expenses due to disability, how do you do that? How can you move out of that and think in a different way of possibilities rather than limitations? We spent a lot of time figuring out how to do that. And when we got started, yes, we had a government shutdown, but yes, we had to think about what does that look like. And that means being able to say small caseloads. If you think of, and I won't pick on any particular agency, but when you think of caseloads often being 100 on a caseload or 200 on a caseload to one worker, that's really difficult to overcome and build that relationship that needs to be built to move forward. I think in general we had a caseload of 1 to 30 in all across Promise, and that allows that relationship to be built and that communication to happen. Certainly the difference and the intersection, if you will, between poverty and disability is one that we have to believe in and have to do something about. We can't just look solely at the disability arena and the services that are there and only look at the poverty arena and the services that are there. We have to bridge those together. So in terms of coordination, I would say the commitment by our staff, I applaud all of the Promise staff in terms of what they have done to meet those individual needs of those youth and families. The commitment to look forward rather than be only in the moment of a crisis or only in what is happening today. We used a lot of supplemental staff. In some cases, it was job connectors that totally focused on connecting that youth or a family member with employment and how to do that. And they worked with the case manager to do it. We also had family facilitators in some of our projects who really focused on how do we make this family be successful and change that trajectory as well. The disability professionals and the poverty professionals, if you will, often we aren't communicating in the same way. We can use the same vocabulary, but it doesn't mean we're in a position to truly understand what we're talking about. And that cross-training, the idea of bringing people together to truly understand what does it mean to be eligible for vocational rehabilitation? What does it mean to be on a Medicaid waiver? It's all vocabulary that oftentimes we can sit down at a table and we may not understand what each other are talking about. That's not a criticism, it's just the way it is sometimes. Oftentimes our siloed services stay in silos. And if we can't get past that, then we aren't in a position to truly wrap services around these youth and families. I'm going to let Kelly talk. On your agenda, it does say that Jade Gingrich is here today. Unfortunately, she had a family emergency. But Kelly is the principal investigator out of the University of Maryland, and she'll be sharing some information with us.
So good afternoon. I am Kelly Crane. I'm with the University of Maryland and have served as a principal investigator on the Maryland Promise Project. As Carol said, Jade Gingrich could not be here today. She is the project director for the Maryland Promise Project. She's housed at the Maryland Department of Disability, which was or is the lead agency for Promise in the state of Maryland. So they gave me leveraging funding to talk about. A big topic. So the Promise projects were funded to implement and test interventions to improve the education and employment outcomes as well as the financial independence of youth with disabilities. The funding structures did vary across the Promise projects depending on how the interventions were being implemented and what partners were delivering those services. That said, all the Promise projects use funds to fill existing service gaps. For example, all the projects, to some extent, use funds for work-related activities, such as work readiness training, and you heard folks talk about this a little bit, paid work experiences. Although Promise had substantial funds to align and deliver these services, it was not without its challenges. Some of the projects, all of the projects, at some point underestimated the cost it would take to deliver key activities. Recruitment and enrollment is an example of this. Recruitment and enrollment took substantial resources that not all the projects were prepared for. Staff training and building the capacity of partners across our projects to deliver services with fidelity is another example where there probably could have been more funding put toward upfront. Blending, so really the projects needed to get creative in how they would leverage these funds. And blending and braiding funds among key partners was one way projects did it. However, this strategy requires the alignment of program goals and eligibility requirements, which can be complicated and difficult. So to leverage the funds, it did take significant time. It was challenging to put these contracts in place within our states or multiple states. Although the sites did have 3 to 6 months to become operational, it was tough. And there was the government shutdown in the middle of that. Not all service or staffing needs could have been anticipated at project startup. As a result, many of the sites had to scramble to make mid-course corrections, get new contracts in place, amendments in place, and that takes a lot of effort and a lot of time. One example that I want to share with you is, again, around recruitment. As we were recruiting and enrolling youth into our programs, the number of youth enrolled did not always align with our staffing structure. And so as a result, we had to go back to the drawing board, make amendments to contracts, get the needed staff to serve those youth in those geographic areas. I'm going to turn it over to Carol to share some lessons learned.
I think that certainly highlights how important it is to have robust systems that work well together. Youth and families are facing so many different agencies and entities, and yet we're expecting them to navigate through that. Within our projects, we struggled with even youth recognizing they had a disability. You know, David pointed out that not all youth on SSI are served in special education or even on 504 plans in the schools. So are they as willing to step forward when we offer services and say, this is something valuable you could benefit from, let me tell you about it? Are they willing to step up and say, oh yeah, I have a disability? So it gave us a different mindset, and when we talk about changing midstream, we did a lot of that. I think the need to meet those families where they are in that moment of crisis, I can't tell you how many crises we could all just list that these families experienced, and yet we had to be responsive to that. One of the gaps that I think many of us forget is the need for identification. And this has changed more recently with the passage of the Real ID Act that requires certain identifications in order to travel, right? We encounter that at the airport. But some of our families who may be homeless or transient, where are they keeping their important papers? So when we have youth turn 18 or want to look for jobs, they need an identification card of some kind. So, gosh, now I need $5 to go get my birth certificate. Okay, now I need $15 to go get my state ID. There are costs established across all of these things just related to identification. And if you don't have that, you're not accessing anything. So simple things like paying for a $5 birth certificate or $15 state ID became pretty prevalent within all of our projects. But we have to improve all of the access. We can talk about accessing services, but it doesn't mean you do it. You can tell someone it's very different to accompany someone. You know, it's easy to say go to the America's Job Centers and fill out a form and you'll start getting jobs that match your skills. Okay, some of our families are not as computer literate as we think they are. They may only be able to access the library computer for 20 minutes at a time. So how do we face that in terms of helping our families? And Promise was able to step in and make some of these differences for their lives by just looking at what are the funding gaps that we can then do something about.
So data sharing and data monitoring, all the sites did do data sharing and monitoring. They did it to ensure fidelity of program services. They looked at data to make mid-course corrections, and they shared data to look at how they could strengthen the delivery of services. All the sites collected individual data on the youth and the families they were serving, and they captured that within their own management information system. They use this data really to foster that state and local level collaborations, and you've been hearing a lot about that, bringing together these different partners. It was important for us to share this data to look where we should put our resources, to fill gaps in services, or to look at what service components were really working and continue to implement those service components. Not all agencies, though, have the same information or collect the same kind of data, which put Promise in a very unique position. We could bring these partners together to do some joint planning and joint service delivery. For example, schools don't necessarily know what youth are receiving SSI. With Promise, we knew that, so we could step in and provide some critical services to those youth. For example, benefits counseling, which was a key service of the Promise project. So we do have an external evaluator. You heard folks mention that already. Our Mathematica partners are doing an extensive evaluation of all the Promise projects. Each of the sites, though, we've been using our data all along, and we use this data to help inform our Promise staff on what behaviors to start, what behaviors to stop, what behaviors to adjust. The data also allowed us to really clarify expectations. What do we hope to achieve? What outcomes do we want to reach? And that was important to constantly communicate that to the staff who are delivering services to these youth and families. Of course, data provides valuable feedback. Are we making it towards our outcomes? Are we going to reach our goals? And then I think importantly, the sites used the data to think about sustainability. They were able to see trends across the different service agencies, and so that data was really important for us as we look to sustain some of these key activities. We also collected data on the individual students and the individual services to the students. This data was important to communicate with our partnering agencies and help move those youth and those families to their goals at a much quicker rate. That said, sharing data, we have to be concerned with the personal information, identifying information. So it was really important for all of our sites to have a clear understanding on what they could share and how they could share it with these other agencies. So that brings me to a couple of challenges around data sharing and data collection. This population is a hard population to engage. They were hard to find at times, so again, we had to get really creative on how to find these youth and how to engage them in the project. And a couple of tools that we used were Youth Find or LexisNexis. We also needed to gain consent from families, especially when we were sharing individual data about a youth between agencies. Gaining the consent from families was not an easy task. Moreover, these families are very hesitant to share historical information, important information that we need to know. Finances was something they certainly did not like to talk about. So that made it challenging to deliver some of the key services. And finally, having a statewide data warehouse can provide a foundation for enhancing existing partnerships and building systems. The Wisconsin project benefited from this structure. However, it's not in place in most states. In the state of Maryland, we are currently developing a tracker to look at individual services students are receiving from schools, VR, and some other agencies. This is a direct result of Promise. Yet we still need more guidance and resources so other states can put this into place.
So we kind of dug a little deep on a few details there, and I'd like to kind of back up and give a little bigger picture of some of the things that we've learned. There's no question that better partnering needs to happen at all levels. Promise set a nice precedent among our federal partners working together. Not that you didn't work together before, but working better together now. And I think even in our states, some of our states had great relationships to start with that I think have been truly enhanced because of Promise. And others, maybe we didn't have as great of partnering in our states, and now we do have better partnering in our states. I think there's better cross-training happening. There's no question that having someone to pick up the phone and call, we talked about relationships with youth and families, but it's as important to be able to pick up a phone and call someone you know in an agency. And sometimes it's someone who has multiple hats, and yet we have people that if they just had one hat, one FTE that focused on that, we could see some significant outcomes as well. In terms of a feedback loop, I think we have to look in terms of policy and the change that we do, the things we try, and then do we evaluate it. That cycle of information results in improvement of not only the relationships of the individual agencies, but also the services that we can provide to those youth and families. Brent said it well, it's not a cookie cutter. One size does not fit all, period. But we have to move forward believing, truly believing, that youth who have disabilities, no matter that disability, If they have the right supports and services, they can go to work. And we've got to believe that we can make a difference in these families. Thank you.
Good afternoon, everybody. My name is Andy Carhan. I served as the project director for New York State Promise through the Office of Mental Health. I've now transitioned over to a position at Cornell, which is our lead research partner and certainly partners in our implementation of this project throughout. What we wanted to spend a little bit of time, and you've heard it touched on in a variety of ways throughout the presentations today, we wanted to talk a little bit about the systemic framework that exists currently within our country. And if you look on the screen, what I see here, and the Assistant Secretary really started to tap into this notion of there's a variety of systems that exist, and we've created really great programs. And I don't want any of us to look down on those programs. We've done a lot of great work in our country to help individuals with disabilities, and I think we need to be applauded for that work. However, when you look at this, there is a significant complexity that exists in these systems. There's the Workforce Innovation and Opportunity Act that includes our workforce system and our rehabilitation system. There is IDEA, which is our educational system. There's the Medicaid system, and then there's also Social Security. And I'm going to talk about just these very briefly, and we have the slides up there. There's more information on here than what I would really want to highlight. But if you look at the fragmentation of how we design our system, sometimes in silos and not always thinking about where the other system intersects. In the workforce system, you have youth between the ages of 14 to 24. And with this expanded focus, 75% of those that are out of school. There is a large assumption there that the in-school youth then are being taken care of in the educational system, and I think that's a good assumption. And you'll see the connections with work-based learning that are existing within the education system and that have been prescribed there. But then you look at what we've learned under Promise is what happens to the youth who exist with significant economic need and students with disabilities that are in that out-of-school youth population. Where do they fall in? And if they do fall in the doors of our America's Job Centers, are they being adequately served? And this is, again, one of the reasons why Promise was funded and created was to look at how do we bridge those gaps. But I think it's important to highlight the gap that exists. In our VR system, we're now at this point, particularly with the passage of WIOA, with this convergence of an increased requirement to serve youth. There is, in particular, this idea of serving potentially eligible youth and eligible youth in the pre-employment transition services that are there and required under the legislation. That's a large ask for a rehab system that in many cases did not serve this population prior to the passage of that legislation. I know it's a significant barrier within the state that I operate within, and I know it's that for other states of how do you even identify a potentially eligible youth, engage them in a system that is built upon and predicated upon engaging eligible individuals and going through an eligibility process. That's a complete systems change and a different way of looking at systems, but that's what is in existence. Then we have IDEA, the educational system that is based on results. And often, as great as our educational system is in America, what you also see when you get into the weeds of special education is not all educators are thinking of this, but they look at a point in time. What is that point in time? It's exit of school. And despite our greatest efforts, the greater educational system is not always thinking about the needs of kids that are in special education and kids with disabilities. It's based upon and predicated upon that high moment that we all sought to attain when we were in school, graduating from high school and moving on to the next level. There is the requirements in this new look at work-based learning within our educational systems. But the question is then, how does that tie into our VR system, and how do families navigate from that system into our VR system or into our America's Job Centers? Where do those bridges get created? Are they being created without an entity like Promise and an initiative like Promise being in play? On top of this, you also have a very, very robust Medicaid system. In New York, probably more than many of you, and many states, and if you follow Medicaid usage, you know that New York is a high user of Medicaid, but the use of a variety of waivers to access and create programs for not only youth, but also for adults, provides yet another door for families to potentially move through in their transition process and moving into adulthood and into the ideas of work. These waivers span across the DD system, the mental health system, the foster care system, the child welfare systems. There's a lot of different waivers in each state that intersect with education, they intersect with our VR programs, they intersect with the existing workforce systems. Sometimes they intersect well, sometimes not so well, and it's creating, again, some of those barriers that you heard were highlighted in our projects. They're highlighted because of the systems that were currently existed and why we're trying to move forward on something different. And finally, we have the Social Security Administration with their emergence of the Ticket to Work program. If you followed this, you know that it was initially authorized in 1999, later amended in 2008, and the purpose of this was to specifically look at how to help Social Security beneficiaries move into the world of work. The question becomes here, where do youth fit in? The youth that we served in youth, many who are not eligible for the Ticket to Work program, it's focused on individuals who are 18 to 64. This is yet another door that families need to try to navigate as they're looking at their students' future. And the reason I spent the time looking through all of these and spending the time talking to you about this is I want everybody to get a full idea of the complexity of what a parent of a child with disability has to try to navigate. I have people who worked on New York State Promise with doctoral degrees, super bright people who cannot figure this system out. And I think that's where I'll leave it.
Thanks, Andy. I'm Thomas Golden. I'm the director of the Yang Tan Institute on Employment and Disability in the ILR School at Cornell University, and was the PI of the New York State Promise Initiative. Andy did a great job of illustrating the complexity of our current disability policy framework as it applies to youth in the United States. And you know, as a PI and somebody who's worked around Social Security return to work issues for most of my career, in writing the grant, probably similar to the other PIs of the other states, you write what you think is really going to work based on all the research that has been done prior. Then you go to implement it just to shake your head and say, huh, that was supposed to work, right? It was supposed to work that way. And so agility became the key to implementing at least New York State Promise, and I'm confident some of the other initiatives as well. But some of the complexity that resides within the framework that Andy was talking about is really in understanding the gaps in that system. And you know, for us, as we think about those gaps, you know, I think probably the stories that have come up from the trenches of Promise from our case managers probably best illustrate those gaps for us. Parents that are saying, there are so many other things competing for my child's attention, I can't even begin to think about layering work on top of that for them. Or our child is struggling enough with their academics, how can we put one more thing on that, right? And so even families and students thinking about readiness to begin to get ready to live, learn, and earn as adults was really difficult with implementing the project. And then finally, the reality that many of the families rely on that SSI check, right? And so understanding the familial and budgetary complexity that's associated with a child going back to work, and the family not understanding what's going to happen to that child's benefits is really particularly challenging. And, the best way to kind of understand, I think, some of the most critical services that were provided in Promise, and you all thought you were going to get out of here without seeing Maslow. Maslow applies in this situation. And really, the key is in understanding, and we're all familiar with Maslow, but the key is in understanding that there's a really critical decision point in Maslow's hierarchy where all of my basic needs have been met. My rent's been paid, my utilities have been paid, I have food in the refrigerator, right? My family is healthy, wealthy, and wise, right? And at that point, I'm then able to focus on my needs for growth, to live and how I'm going to earn, and am I going to continue to learn, right, as an adult. And that's a real pivotal decision point for New York State Promise Youth. And as you think about the framework that Andy just presented and my colleagues talked about before, the majority of services that we're talking about that are currently a part of our disability construct in the United States are all above the line, right? They're not targeting the things that are below the line, right? I remember a voc rehab counselor who came to one of our learning communities we did, that when we began talking about the need to serve the family, they looked at me rather oddly and said, "We don't do that. That's not what we do. We serve the individual, not their family." And that created this real aha for me, saying our biggest gap in solving the problem for SSI youth and their families is in realizing that a youth-centered approach is not enough. That oftentimes the obstacles and the barriers to being ready to get ready to go to work, to get ready to go on to school, reside within the familial construct as well. And so Maslow has a lot to teach us about that. And, I reinforce that with just a little bit of data here, right? Now, any good academic is going to use data that tells their story the best way, right? So, of course, I picked this data. It's a 2-year snapshot in time of VR outcomes for youth. Those are individuals under the age of 25 in the United States that were served across voc rehab. And of all the youth that were served, 1 in 5 of those youth had SSI. Okay? 1 in 5 had SSI. Of those 1 in 5 that had SSI, after VR was all said and done, only 1 in 4 went to work. Those are disturbing statistics. Now, this has nothing to do with Promise. Don't get out of here and say, "Oh, Promise did a poor job." This is national VR data, right? Taking a look at their outcomes. Only 1 in 4 went on to work. Now, here's the good news. 2/3 of those that went on to work were in competitive integrated employment. 1/3 were in supported employment. Those are really good outcomes. But I think what this data represents is that there are a large number of those youth that come into the system who aren't ready for our systems. And so there needs to be services that help prepare them. I'd be remiss to not talk in closing about the gap that exists with the current ticket to work. Too little, too late. Right? We're talking about needing to serve youth much, much younger than what they are right now. And what we know is that if youth could come into the current system, ENs, employment networks, would need to wait way too long to get their money based on the current milestone system that's in place or outcome system that's in place. And so a youth-sensitive ticket to work program would take into consideration that probably evidence-based services need to be paid for, not just outcomes, right? Also, that there probably needs to be some hybrid of fee-for-service and outcomes coupled with that, as well as making sure that familial supports are a really important part of that. And so what we know is that youth and families all need to be served, not just the youth, and we need to evaluate our current disability policy framework within that context. Is it doing a good job of serving families? Also, does it provide the level of intensive case management that families need to have to maneuver this road? And then how can we maximize those pieces of the framework that Andy was talking about, like Title I and Title IV? How can we crosswalk those better so that, going back to our podcast at the beginning, some of those great stories of moms and dads that got jobs as well, and the whole family was lifted out of poverty, not just one person, is going to be critical to our success going forward. Thank you.
Hi, I'm Ellie Hartman, the project manager for Wisconsin Promise, and the lead agency for Wisconsin Promise is the Division of Vocation Rehabilitation. What I'm going to try to do, I know we shared a lot here, is to summarize lessons learned, highlight those, and then talk about some potential policy recommendations to consider. These are just some samples. Obviously, there's many more to consider, but get a sampling of that based on all our lessons learned. So the number one thing I think we can all agree on is our biggest aim and the biggest impact is when we connect youth with disabilities to paid work experiences. And what we were able to accomplish that in Promise, and we want to continue to do that moving forward. So how can we do that? Because we saw during recruitment and enrollment that even though youth and families were eligible for services and systems, that they were not always connected to services and systems. And when I say that, I mean even schools. So we found youth might not have an individual education plan, or even if they did, maybe they're dealing with disciplinary issues, truancy-related issues. The family might be dealing with, as we talked about, there's a lot of poverty-related issues. And so they might not be as engaged in school as we expect. So we talked all about that. So how do we ensure that youth and families know about these services and supports, and how do we get them to trust us with these services and supports? And so we need to do a better job of targeting our outreach to youth receiving SSI and their families to ensure we're getting to them. And that's postcards, texts, emails, not assuming that our service systems are always connecting with them, but ensuring that that's happening. And even better is then that targeted case management, helping navigate the system, helping to increase expectations, but in a way that is empowering, because we know that our youth and our families have so many talents that benefit all our communities. So they are the ones that will build our workforce. Right now, we have low unemployment rates, which is great, right? Our employers are looking to build their workforce, and we know, and we have seen this in Promise, that our youth are filling those workforce needs, and our family members are. So this is what we need to make sure that all our systems are doing. And when we do that, we need to make sure that our materials, our case management, our targeted outreach is accessible to our youth and families no matter where they are. Whether they're homeless right now or they have different disability needs, we need to make sure that we are accessible and we are reaching the youth and the families that we intend to reach. And finally, when we are thinking about those employment options, that we're not doing, as everyone said, but I'm going to repeat it, that cookie cutter approach. Our youth and our families, they have talents. We need to match those to the local employer needs. We need to be, that is our main job, is to find those good job matches. And we talked a lot about employment, but when we're talking about employment, we want to help build youth and families to go from employment to that financial self-sufficiency. And to do that, we need to talk about how do you ensure youth continue to get the services and supports that they need. So talking to benefits counselors, how do you ensure they still have that health insurance, the services and supports, but work to increase their overall income and then start to build assets, right? So that's the big thing right now, is not only that benefits counseling, but that financial coaching and building those assets. And we found in Promise, many repeated that relationship building is key, so starting with individualized services. And then, as we build that trust, expanding out to more group interactive training and networking, and not only that, but then building our youth and families to become leaders in their own community so they can be part of the solution. Because I will tell you, in all our states, we are seeing our youth and families becoming leaders and developing projects that are benefiting their communities. So connecting to employment. This means, yes, through the traditional methods, through schools, voc rehab, but also, what about those internships, apprenticeships, other options? If they're in foster care, are we connecting youth with disabilities to the employment opportunities through those programs? And so connecting to a variety of different programs. In Wisconsin, we have youth connecting to other youth with disabilities in their communities to tell them about internship possibilities and connecting them to the different opportunities right in their community. And as we do that, we need to consider the different factors: transportation, technology, and housing, making sure that those pieces aren't being ignored. And I mentioned employers a bit, but they're an important partner. And how do you continue to partner with those employers? And I just want to share, in Wisconsin, what we do are community conversations. And so it's not just what we're doing, not just the services we provide, but we have community conversations in all our communities across Wisconsin to talk to community movers and shakers and businesses and the service providers and the schools and the youth and families to talk about, okay, how can we work together to increase employment for youth with disabilities in our community? What can we do? And when we do that, employers step up and they come up with ideas and they ask to be part of the solution. So what does this mean for policy recommendations? So in Wisconsin, what we are looking towards with our competitive integrated employment initiative is to partner together to do this outreach through data sharing agreements. So our state Medicaid knows who is receiving supplemental security income, so we can use that contact information to outreach to youth and families. Another potential partner would be the Social Security Administration, because they also know, whereas other partners don't know. So we need to partner together to do that outreach as a collaborative effort. Other options is to ensure targeted case management or family navigators for transition age youth receiving SSI. Not all youth have a case manager. And so maybe we need to make sure that is a possibility, maybe through Medicaid targeted case management, maybe through other means. There it is. Asset development. I talked about that, connecting youth and families to those options. So through the Plan to Achieve self-support, past plans, the ABLE accounts, achieving a better life experience, or even setting up individual development accounts, or maybe your Medicaid buy-in program has something, a savings plan like we do in Wisconsin, independence accounts. So making sure we're not only increasing that earned income, but also assets. Oops. I apologize, I went backwards. And then at the federal level, I know my time is up. I had some Social Security policy recommendations that would align with that. So Social Security helping with that targeted outreach, family navigators or case management, as my colleagues here talked about, establishing a youth ticket to work milestones, increasing the funding for that important benefits counseling piece, the work incentive plan and assistance program, And then ensuring local staff know about the work incentives, because I will tell you that we had experiences where we are helping youth work, and then they go to the local Social Security office, and the local office would be unaware of some of those work incentives right in those programs. So making sure that everyone on the ground is aware of the value of work and the different mechanisms where they can increase their income and overall financial self-sufficiency.
Wow, trying to synthesize 5 years of work. Incredible. Thanks to all the Promise managers for your thought-provoking presentation. Rather interesting and stimulating. Well, why am I here? I'm here to introduce my good friend Richard. Rick. I've known him for almost 30 years. And I think the first time I met him was in San Francisco. I just finished my graduate program and was working on what we call the Marriott Bridges from School to Work project, funded by the Marriott Foundation. Yeah, that's how old I am. If I should say everything about Rick, I'll probably spend the whole day or write a thesis. So I'm going to synthesize briefly some of his remarkable work. When I thought he was retiring, or he had retired, he's still around. He's currently the co-director of the Center for Transition and Career Innovation for Youth with Disabilities, and he's a research professor at the University of Maryland. For 28 years, he had served as the president of Transcend, and I'm sure you're all familiar with Transcend. During his tenure at Transcend, he was responsible for implementation of numerous model, demonstration, and research projects related to school-to-work transition for individuals with disabilities. I think you got one of our grants too, right? Yeah, you did. Dr. Lucan's professional history also includes serving as a state vocational rehab counselor and the director of nonprofit competitive integrated employment service programs. He also served as a policy advisor to the U.S. Department of Labor, Office of Disability Employment Policy, where he helped establish its National Employment First initiative. His research interest is in the translation of knowledge for both policymakers and practitioners. Rich, welcome aboard. Good to see you.
Thank you, Solete. It was 30 years ago that we first met, so that kind of dates both of us, but Solete looks much younger than me. So hi, everybody. My job here is to synthesize what you heard in just a few brief remarks, and I promise you that they will be brief because we want to save as much time as possible for questions and answers, which will be the second part of my job, is to moderate that part of the session. But just a few comments. It's really hard to overstate the importance of the Promise investment. Forget about the amount of money involved with it, forget about all the federal agencies that came together to make this happen, and that's important. But there's three reasons why Promise is so important. The first reason is, on the one hand, we have the underpinning, the implicit underpinning of federal policy, which is presumed employability, the idea that anybody with any disability can go to work if they want to, provided they have the right supports, and you heard many people talk about that today. And on the other hand, you have a group of individuals who, because of poverty and disability, two characteristics, by the way, that are associated with lower employment rates, How do you address the disparity between what is implicitly believed to be possible and what are the realities of individuals on SSI? Who, by the way, and Thomas Golden kind of pointed it out in his presentation, have among the lowest employment participation rates of any group of people with disabilities. So to have an investment that says, let's take what we think can happen to the people who are least likely to have that happen, and let's see if we can make that work. So that's the first thing. The second thing is that how about if we apply research how about if we apply components that are supported by research as influencing positively these outcomes? So here we heard today that work experience being one, family engagement and support being the other, and these are married into a component of service, components of service delivery that all of the project promises were obligated to implement. So that's a pretty big deal, to take a research based intervention and apply it directly. And the third thing that this is the reason why Promise is such an important investment is that it required everybody to do this under rigorous research environment of randomized assignment. In other words, they had to go out and recruit youth and say to them, we have this idea that we can help you with, and by the way, 50% of you are going to get this, and 50% of you are not. Not an easy task, but to everybody's credit, sitting here at this table and other people that talked today and the people they worked with, they pulled it off. They absolutely pulled it off. So to their credit and to the vision of the federal partners that created the program, that's kind of a big deal. So here's a couple of quick things I'm going to throw at you before I turn it over for question and answers. We heard last week the Mathematica Policy Research folks are doing the evaluation of this project, and we heard them say last week in a webinar that across the board, all 6 projects, early impact is that the control group is employed at much lower rate than the youth who got these services that they all described. So already we're seeing some impacts. So we heard somebody say 90% of their students got work experience, or 95%, whatever. Now, all of them achieved that benchmark at quite a high rate. So, which tells us that yes, we have an idea of what can work. So we don't know if this is going to be sustained over the long term, we'll see, but that's important to know. And so the early impacts are good. So today, what you heard was the people who pulled it off, the ones who implemented this to make it happen. And they talked about their challenges, they talked about what they learned. And so now our challenge here, our collective the policymakers in the audience, the researchers in the audience, the practitioners in the audience, all folks who are concerned about this issue, what can we do to create policy and practice that takes what we learned from this and have it happen for more youth on SSI and other youth who are having impediments to employment? So how did they do it? They talked about that. What did they learn from it? They talked about that. Now it's time to talk about what is it that we can extract from this this demonstration. And I'm sure that you all have questions that you have for the group. So we have just a short period of time, about 15 minutes, to field questions from the audience and have the panelists here representing each of the Promise sites have them answer them and address them. So let's start with anybody who has a question they would like to address to the panelists.
So my name is Jim McCarthy, and I actually work for the Department of Education now, but I have a long history in disability policy. And everything that Thomas Golden said didn't surprise me at all. And, all of that are things I think anybody who's been in this realm very long understand. What surprised me, I think, the most, Carol said it for sure, Ellie from Wisconsin alluded to it, and others said it, but what I think surprised me the most is that there are youth on SSI who aren't getting 504 idea plans and probably weren't going through vocational rehabilitation either. And I certainly understand one of the early commenters said, you know, what these families had was consistency. That SSI check was consistent, and what they don't have is trust of us in the system. But I guess, like, what do you guys think is the answer? Because I would have told you before coming in here that the systems knew everybody on SSI, and it was a system failure not to get to them. I mean, that's my sort of person with a disability hat on or whatever, but that would have been my answer. And I think that's too simplistic. So what is the answer?
Yeah. So if I could paraphrase the question, the issue is that since so many of the SSI recipients are not either on IEPs or 504 plans and also not receiving vocational rehabilitation, what does this mean in terms of our policy implementation, and how do we address this? Is that fair? Yeah. Okay. So who wants to tackle that?
So I think I was touching on that. I think our systems need to recognize that we're not always connecting with them, and we need to figure out how we can better connect with them. Now, we know Social Security knows who all the folks are. We know that Medicaid knows who all of these youth are. So there are some systems who know, but then the systems that are actually providing the education and employment services don't necessarily know. So that's when that partnership and working together to target folks to let them know of the other services, but it's got to be in a way that folks are like, oh, sure, I'll go do that, because like we talked about, folks are leery. They've got burned by systems before, and if we make it difficult that they have to jump through the hoops, and they're just trying to make sure they keep a roof over their head and the family fed, that's probably not going to be sufficient. And so we really need to think about not only partnering together to target and identify folks so they don't slip through the cracks, we also need to change the way we're implementing our systems so that we better serve our youth and families. So it has to happen at a collaborative level, or it's not going to work.
In fact, I'd take that one more step, because that's kind of what I always do, is a typical format is you're reaching out to someone, you call once, you call twice, you send a letter, they don't respond, you're done. If we're serious in this room about systems change, that will never work. In Promise, we dedicated an enormous amount of our staff at the early days for recruiting. We kept a staff on separate and apart from our case managers that were just about retention. Knowing where people are, knowing what list they are on, having that knowledge takes you about half the way there. If you're going to reach the destination, if you're serious about it, it's going to have to be a functional mechanism that does ongoing outreach. You're right, they're leery of the system, they've been burned. One of the single most beneficial things within Arkansas Promise was Social Security benefits counseling. They knew, Social Security had the list, we knew who our AWIN counselors were, but it took Promise in an active, facilitatory way to hook our families and youth up with AWIN counselors. So knowledge is one thing, but if you're serious, it's going to take a dynamic, functional model of ongoing outreach if you're serious about making a difference.
And I would just add, too, that it goes back to if they walk in one door, does that door and that entity understand all the other doors? Because you can walk in the door for TANF or SNAP, and your needs are greater, but you don't even know that. So having the entities, the agencies, the organizations truly have a strong understanding of what it means to be eligible for other programs and how to access those and accompany people through that process. It's both the constant search, if you will, and contact, but it's about really understanding each other. Because if we don't understand each other, we can't really help them beyond our little silo. We've got to get past that.
We had about 10% that did not have an IEP or a 504 plan. And as we went back and looked at those, a lot of it is fear on the part of the families. If I come and ask for some support in those services, what's that going to mean? In California, obviously, that gets into issues of documentation. It gets into certain cultural groups where they're naturally fearful of exposure, for lack of a better term. So I don't think that there's one solution that fits all, but it surprised us as well when we saw those numbers.
Yeah, I just add briefly, my name's Andy Sink. I'm director of New York State Promise. I'm the only one you haven't seen yet today. So I just popped in. One of the ways that we talk about it, and I think this is what we're all saying, is that these individuals and these families are not our traditional seekers of service, who our state service systems serve successfully. And to be able to do that, it's that high level of touch. It's that high level of knowledge. And one of the things that we talk about is the level of case management, the level of family coaching. And you say case management, you say family coaching, you have a general idea of what that means. But what we realized very soon was the people who did that well are so good, that role doesn't exist anywhere else right now. Because you're needing to understand all of those, the intersectionality of those different state systems to be able to do that, and then to talk to somebody about it and make them feel okay to talk to you about it. And if one door doesn't get to the other one, you're the one that's opening that door and figuring out how to do it. So that level of intervention, I think, is one of the biggest things that we learned.
And I would add just one quick thing about the population. It was a surprising population. We were surprised about the number of youth who did not have an IEP or a 504 plan. But we were also surprised and I'll speak for the state of Maryland, we had a large percentage of youth, I think it was around 30% of the youth who had non-obvious disabilities. And again, these kids weren't necessarily connected. And we were in a unique opportunity because we knew who these youth were and we could connect them. But it was a really surprising population to us as well, because of the non-obvious disability and not being connected to services from education, for example.
I just wanted to add one thing from Carol, no wrong door, is the fact we found out when there was a request for information from Social Security. I guess I didn't realize this, but Social Security cannot refer youth to VOC rehab. Like, they can't. And it's like, wait a minute. If we're doing this whole project to increase employment for transition age youth, then I mean, maybe the first thing is to change that because when they come into Social Security, they should be encouraging folks to seek out employment opportunities and be able to, whether it's through VOC rehab or whatever opportunities there are. It doesn't have to be VOC rehab, but that should be something that a Social Security rep is telling people about, not telling people, oh no, don't work. That's, so that message needs to change.
This is Annette Shea from Administration for Community Living. Happy to see some of my Medicaid infrastructure grant buddies here. This question I think is probably for Thomas. Sorry, maybe you feel picked on, but I think one of your recommendations was the youth focused ticket-sponsored employment network option. One of the things that happened post-Promise going live was the added service to the Centers for Independent Living, which included a subset of transition age youth as the new core service. Certainly, I think if that model were able to happen, this would benefit the Centers for Independent Living tremendously, and I'm just wondering if, in your experience, were you hearing that from the field? I mean, were you getting pushback from the SILs at all, or any other project saying they don't have the resources or the mechanisms that they need?
I don't believe that I've heard pushback on that other than, anecdotally knowing, I'll go back to the case of the VOC Rehab Council that I talked to that said, a family service doesn't fall in alignment with the constellation of services that we're legislated to provide, right? Or that we're regulated to provide. I don't foresee that an independent living center would ever be opposed to, promulgating more work, especially in this area of transition. I just don't know that all independent living centers provide that level of service, right? I don't.
I wanted to add to that. We actually worked a lot with our independent living centers, especially around our social skills training, skills to pay the bills, and our self-advocacy training. And they built their curriculum to help with the pre-employment transition services. And so that is something that we benefited from through Promise, is our partnerships with our independent living centers to provide those additional services. So at least with the pre-employment transition services, I think they're already doing, at least in Wisconsin, doing more work as a direct benefit of this project.
I also think, just from New York's perspective, we have a very active administrative employment network. And one of the things that we learned, if I could broaden this sort of beyond the independent living centers, is they being part of the sort of service provision field, is that many of the service providers that we engaged that's expressed that they wanted to serve individuals at a younger age felt very strongly that they had the capacity to do that they knew how to do it, and they were going to be able to do it. And while we have had success, one of the things that we learned early on was they didn't know what they didn't know. It hadn't, they hadn't done it yet, and they said, well, we've been doing this very successfully for older individuals for a very long time. We know what, we have our best practices, we have our evidence-based practices, and I think that, so I think that the service community as a whole sort of is in that learning curve, and so maybe, being able to serve youth at a younger age is something that they wouldn't know that they didn't know.
Yeah.
Thank you, John Tambernino, Office of Management and Budget, White House Office of Management and Budget. Let me just add my voice to sort of the chorus of praise for everyone up on the panel, but everyone in this room who made Promise a reality. I was involved a little bit at the beginning and moved away from it, but I couldn't be more impressed, actually, in just seeing how it came to fruition and just how the excellence that I'm hearing about this afternoon. There's been a lot of emphasis on systemic change and communicating and coordinating and collaborating across various silos and barriers and those sorts of things. And my question is, and so it sounds like Promise really has catalyzed a lot of the integration and relationship building amongst service providers that was absent. My question is, to what extent does that seem to be somewhat permanent or more fragile? And if this newfound integration and relationships is more fragile, what are your thoughts about what's necessary to sustain it?
That's an excellent question, and unfortunately, we only have about a minute left.
I think we should answer
5 minutes? Oh, okay, we're going to go over a little bit. Okay, great. Well, that's really an important question. Anybody want to dive into that? And I would just ask, because we do have just a little bit of time, to keep it as brief as you can.
Okay. I would say it is more robust and more stable and more fragile. I think it is both. I think that within our state systems, the ability to know each other and work together exists, but it is often dependent on an individual in that agency and their personal commitment. It has to move beyond that, because even while that makes it a strength, you have someone who is the expert, who can carry that message. When they leave, that's where the fragility comes in. So it has to be beyond a single person, but it needs to be engaged within that agency and that commitment to something different than what they've been doing all along.
I will say in Wisconsin, we had Act 178 pass that requires our agencies to work together towards increasing competitive integrated employment. And so we're able to build on Promise and other demonstration projects and move them forward. And so having that in state law is helping to provide that catalyst needed to make sure there continues to be people who move that collaboration forward.
One additional that occurred in California was developing local planning agreements between schools, Department of Rehab, developmental disabilities. And through those at the individual local communities, that's actually pulling some of these pieces together and are building on sustainability. But it is fragile. There's no question about that.
Yeah, and I would add, in the state of Maryland, and I mentioned this, so I think the collaboration between agencies is stronger. We see them traveling the state together, education, VR, DDA. They have the same message, but also in the state of Maryland, as a direct result of the Promise Project, we are developing a tracker to really look at the individual services, transition services for youth, moving them toward employment. And this is a collaboration between education and VR at this point, but other agencies will be coming in on that effort. So we're really excited about that.
Very briefly for New York, we were able to establish our Promise Steering Committee with all of our statewide our state agency Promise partners as the Governor's Employment First Subcommittee on Transition. And so throughout the process, we were trying to use our steering committee for them to be able to see how Promise is rolling out. What are the challenges that our system has? So as they have more of a commitment and more of a charge to develop and implement youth services that they could learn from Promise. So we're hoping that sort of learning process will continue.
I think
Brent?
just real quickly, in Arkansas, and I have to be careful because my VR commissioner is in the audience. Besides just data sharing and mechanisms of dissolving silos, I think it's also, and we've not used this term yet, so I get to be the first one today, rating of funding. Understanding that oftentimes programs are duplicated not only from Office of Workforce or VR or other agencies, but often funding streams can be allocated and considered in different ways, and that services are often enhanced when the rating of funding is understood in terms of what is pre-ed services, in terms of what job coaching can be provided, in terms of funds being used to pay wages, that a closer examination of the utilization and the rating of the funding streams can go a long way to making this collaboration a lot less fragile.
Corinne, how much time do we have? Okay, well, I guess we'll have to close there. Just a couple of things. It is a great question you ask, and I think it's really important for all of us to consider how do we sustain this. And so that's the challenge here. But here's what we know, which is really important. And getting back to my original comment about the significance of the investment and of the project, is that we know work can happen. We know it can happen. Now, the challenge is how do we coordinate the systems to make that happen for more youth? Another way to say it would be for this whole project, to put it into vernacular, it's a BFD. You know what that is? Yeah. A big freaking deal. This really is a very significant project from which we've learned some significant things and from which we do have challenges to go forward and take what we've learned and apply them. So thank you all for your participation in this session. Thank all of the panelists. I'm sorry? Yeah. So we're going to, after we end here, we're going to be able to stay in this room for another hour till 5 o'clock. So that anybody here wants to network with the panelists and the presenters and anybody else you have want to talk with, we'll be around until that time. So thank you again for your participation.